Okay, good morning, everybody. It's 8:30. I think we'll begin. I call the meeting to order. Affidavit of posting is as printed in the agenda. Entertain a motion to accept the minutes of November 12th, 2021. Motion by Chris Dice. Do I hear a second?
Second.
Second by Dr. McManus. Are there any questions or concerns regarding the minutes? Seeing none, all in favor, signify by saying aye.
Aye.
Any opposed? Okay, we'll move on to the COVID-19 update. I have a couple of things I want to bring up that I think it has happened in the some relatively new news, but I wanted to bring it forward for discussion purposes. Earlier this week, Dr. Fauci stated that we're never going to eradicate COVID-19. I read a published study on Omicron from South Africa. I just want to read a couple of quotes from it. The wave increased at a faster rate than previous waves, completely displacing the Delta variant within weeks, and began its decline in both cases and hospital admissions in the fifth week following its commencement. There are clear signs that case and admission rates in South Africa may decline further over the next few weeks. If this pattern continues and is repeated globally, we are likely to see a complete decoupling of death rates, suggesting that Omicron may be the harbinger of the end of the epidemic phase of the COVID pandemic, ushering its endemic phase. And then on Wednesday, CDC Director Walensky testified before Congress, and she stated, when compared to Delta, infections with Omicron were associated with a 53% reduction in adjusted risk of symptomatic hospitalization. Displayed in the first panel, a 74% reduction in adjusted risk of ICU admission. Displayed in the middle panel, and a 91% reduction in the adjusted risk of mortality, displayed on the third panel. No patients with Omicron required mechanical ventilation. Additionally, the study found that those infected with Omicron who were hospitalized had a shorter duration of hospital stay compared to those with Delta. The duration of hospital stays was approximately 70% shorter, with the median of stays being 1.5 days for Omicron compared to about 5 days for Delta. Looking at all hospital admissions for Omicron, 90% of patients were expected to be discharged from the hospital in 3 days or less. So it appears to me that the federal health officials are starting to make a pivot, and I think that's well worth looking into and discussing further, so that we can be ready for that once we start looking at, moving into more therapeutic treatment for this disease, and realizing that unfortunately COVID-19 is here to stay. So with that, I'll turn it over to Acting Director Beckler. So
thank you. Yeah, I agree with everything you've said, and we're hopeful that after this spike that we're supposedly going to see happen in the next couple of weeks, and then hopefully a decline. We've heard some talk from DHS that they're planning on shifting their expectations for the way that we are responding to the pandemic. We haven't gotten any details on what that's going to look like yet, but I am hopeful that they will allow us to back off in a little bit of the contact tracing and focus more heavily on vaccination rates and actually helping those who have the more strong cases, the hospitalizations, those who actually really need our help, instead of just trying to call everybody that we know we're not able to reach at this point. And that kind of segues right into my COVID update for today anyway, starting with the fact that we are seeing an extremely high burden rate right now. Not shocking to any of you, I'm sure. We're seeing over 1,500 cases per day in our department, which is extremely high. Just to give you a bit of reference, this past fall when we thought we were getting stressed out, we were seeing about 100 cases per day. So our contact tracing team is not currently able to keep up with every single case that comes into our department, and I don't believe we're even getting the results for every test in a timely manner at this point. So we're working in crisis mode. We are prioritizing the cases that we follow up on. We're attempting and succeeding at reaching children that are in school, and we're working on trying to reach the elderly populations, and we're focusing on hospitalizations and the long-term care facilities, nursing homes, those who really need our attention the most. But even that has become a very, very large challenge to keep up with at this point. Vaccine rates, we are at 65.5% of the total population has been fully vaccinated in Ozaukee County. Washington County is at 52.9% compared to the state rate, which is 58.4%. So we're kind of on either end. Ozaukee is a little higher. Washington County is a little bit lower than the state average. In Ozaukee, if you're interested in children's rates, we are at 26.2% of 5 to 11-year-olds who have been fully vaccinated, and 67.8% of 12 to 17-year-olds. Washington County, we're at 10.9% of 5 to 11-year-olds and 39.4% of 12 to 17-year-olds. So while those numbers are still a little bit lower than the adults in the total population, they are continuing to increase slowly. So we're hoping that we'll be able to continue focusing on increasing those rates over time. Boosters are also now recommended for ages 12 and up. So we're hoping to see that that number continues to increase as well. We are providing in-house clinics for Moderna. This week in Ozaukee County, we had them on Tuesday and Thursday. And then on January 25th and 27th, we will be having them in our Washington County office. We've been hosting those clinics for a couple of months now, and at first we saw a great demand for it. We were filling up every single time slot every day that we had offered them. We're seeing a little bit of a decrease in that, so we may shift our focus in the next month or so, but we have yet to have that conversation. So we're going to see how the next couple of them go before we make any decisions. As far as testing goes, testing supply is very difficult to come by across the board right now. It's a nationwide issue. I know that it's on everybody's mind. Where do you get tests? How can we help? We are currently working on starting up a new contract with a new vendor to potentially open up a couple of sites in each county for weekends. I know that that's been in demand for a while now, so it takes a while to get those set up, but we're hoping to have that up and running in the next couple of weeks for weekends. And Curative currently in both counties is operating by appointment only, and that's due to staffing issues, lab capacity, and of course, lack of tests in general.
Hey, Kim, a quick
Yeah.
question for you regarding testing. Would it be appropriate for our health department to maybe strongly suggest to people that are not sick or experiencing any symptoms to forego testing unless they are symptomatic? Is that a problem with us, or are we having people coming in that are symptomatic only for testing?
Well, now that I was going to mention this as well, but the OSHA mandate was blocked by the Supreme Court, so now it's a little bit easier to say if you don't have symptoms, you don't need a test, don't use a test. Okay. If you are sick and you know you were exposed to someone, and you can get away with not testing and just isolating and acting as though you're positive, we also are recommending that just to keep the test for those that actually really need them and are not sure if they were exposed to positive. That would be my preferred method. It's a little difficult because in the school settings particularly, we still are requesting that students get tested if they were exposed to a positive, even if they are not symptomatic, just to make sure that we're catching those cases before they possibly spread it in a setting like that. So it kind of depends on the situation. But yes, we are working on some messaging to try to keep those tests available for those who really need them.
Okay, thank you.
Yep. Schools, while I'm on the subject of that, we have also been encouraging them to set up a testing program that they can work directly with the state of Wisconsin on to have testing availability in their own schools. Quite a few of them have taken us up on that offer and are working with vendors to provide that for their families, which has been working out well. And then they are also able to order N95 masks straight through the state as well if they are in need of those. And I actually just heard an update that long-term care facilities are also able to do that. CDC guidelines for quarantine and isolation were recently changed. I'm sure all of you have heard of that already. They are now 5 days for isolation and quarantine. We have been working very hard on updating our own internal guidance for the public to reflect that change. It's based on recent CDC data that shows that most transmissions tend to occur earlier in the infectious period than they originally thought, and that in conjunction with some of the societal impacts that COVID has across the board that they were not necessarily focused on earlier in the pandemic has led them to changing that recommendation.
Seems to me that that we forget that it's 5 days plus 5 days of masking, which has been an issue. I know some of the school systems are not requiring masking when people are coming back after those 5 days, and I think that that's a big mistake.
Yeah, and for those who are unable to mask for that additional 5 days, we also recommend isolating for 10 days instead of 5 days. So that's one way that we would recommend getting around the masking for those who really are just unable to mask or extremely disinterested in doing so. But again, that's our recommendation and we cannot force their hand. So it's a struggle. Each school is doing it a little bit differently, but they are trying their hardest, I think, to keep COVID out of the schools. And we've been working really closely with all the schools in both counties to try to make sure that they are also changing their mitigation strategies to align with CDC and our recommendations.
Hey, Kim, this is Steve Zills. Just one other thing too to mention, going along with Dr. McManus's point there, up to 30% of people will still remain infectious after those 5 days. And that's part of the reason why the CDC recommends that mask after 5 days. So again, just to stress his point there, masking for that second 5 day period is critical, as I said, because up to 30% will still be infectious after those initial 5 days. So I think if you meet with the superintendents, it might be important to stress that with them too, just so that they're aware of that.
Absolutely. Thank you, Dr. Zills. I don't have a whole lot of more updates. I already mentioned the OSHA mandate for businesses was blocked by the Supreme Court this week, and that separately from the CMS healthcare mandate, that one is still standing. So we're also, I know I've talked to Dr. Zills a couple of times this week. We're working on trying to figure out ways that we're able to support our healthcare facilities in the area. That's going to be an ongoing conversation, though, as things change from the state. I've got, does anybody else have any questions for me about this? Or the topics that I maybe didn't bring up?
Can I just add one thing? You had touched on it just briefly there, Kim. Just so everyone's aware, all of the health systems, as I'm sure you've read in the news, are in a world of hurt right now. One of the issues that we have faced is, like every other industry, can we have some baseline staffing shortages? And then you add on just the extreme caseload we have from COVID, and it's really kind of forced the health systems to their breaking point here. One of the things that I think the board should just be aware of is most of the long-term care facilities, if not all, have halted any admissions because they also are facing staffing shortages, as well as having some kind of localized outbreaks of COVID within their own staff and or residents. As Kim mentioned, she and I have been in contact because what's happening is the patients essentially are backing up into the hospitals. So patients that could be discharged back to long-term care facilities aren't able to be discharged because the long-term care facilities aren't accepting them. I did hear just yesterday, I saw on the news and had some kind of previous knowledge as well, that the governor is working to train some National Guard members as CNAs. And those National Guard members then will be deployed to hospitals and long-term care facilities to help fill some of those voids. I think that's great. I'm just a little bit concerned how long it will take to train those National Guard members and actually get them deployed into the long-term care facilities. So I'm not really sure the answer to this one, but I just wanted to make everybody aware that that really is an issue that we're facing with regards to getting those patients that are able to be discharged actually back to their long-term care facilities, and hence opening up other hospital beds.
I have a question for you, Dr. Schultz. I've read a few articles about, the staff shortages due to the vaccine mandate, and that some of the hospital employees, some of the healthcare professionals are having to serve, having to go on duty after a positive test. Are you seeing any of that, or is that just an anecdotal type report?
I think it depends on the area of the country that you're in and sort of the how dire the staffing shortages are. I'm not aware of that happening locally, but I have, read probably the same stories that you have of places. I believe one of them I read was out in Rhode Island, where that was at least in their plan. I don't know if they executed it or not, but it definitely was in their plan if they needed it.
Okay. Yeah, it seems to be kind of counterproductive, but if the staffing shortage is due to the lack of vaccination status, causes healthcare professionals that are testing positive to actually serve and have interaction with patients, seems to me to be kind of counterintuitive. But I guess what has to happen. So.
Well, Don, this is Nitish.
At least in my mind, the staffing shortages were ongoing prior to the vaccine mandates. There is a couple of percentage of people who have been lost during for that mandate, but the acute staffing shortages have come from the large number of people that with Omicron, that even though you've been vaccinated, you get a mild case or you get tested positive, even though you're asymptomatic. And so, that's made what's been the biggest issue as far as the staffing shortage right at this moment. There is an underlying staffing shortage. I think that the nurses and doctors and everyone that's been doing this for the last 2 years are kind of burnt out. And so some of the people have just made the decision that they look at a different industry. But I think that it's the Omicron that's causing a lot of the staffing shortages, just because the healthcare workers are getting sick.
Mm-hmm. Yeah, I think I've got it now too. I got the headache, the sore throat, so I've got the initial onset, which happened very, very quickly yesterday afternoon. But that's the only symptoms I'm feeling right now.
Hopefully you get well quickly, and hopefully it's not COVID. But this is Nitish, and I work at Children's Wisconsin, and I could just kind of tell you what's going on here with that, with staff being, one of the biggest issues, like Dr. McManus was saying, is that there already was a baseline issue with staffing. And I think that's one thing that we've been seeing, is that we do have some burnout, and we do also have some jobs out there that pay even better than they do sometimes for jobs in the hospital. And so that was something we were dealing with before anyway. But as far as people being sick and being diagnosed with COVID, at least in my department, we have been able to have some people work from home, because what we're finding is that those who are COVID positive have very, very mild symptoms. We have nobody who's working right now who is unvaccinated in the pharmacy. Everyone is vaccinated. They have to be. And we have nobody that we are aware of who has a medical exemption. So we're seeing very, very mild cases. Usually it's been a little bit of nasal congestion and a mild cough, and it usually is about 48 to 72 hours. But when we can, we have people work from home, and that's been very effective for us. Not every department is able to do that, but certainly the pharmacy has been able to do that. And then what's happened is most of our pharmacy leaders have then had to kind of fill their places so that we have kind of that on-site work that's being done. And I know nursing is doing the same thing. If they can, then they have a nurse who works from home, if at all possible. Maybe they'd work on some projects or whatever. But that's kind of the way that we've been trying to fill all of our holes right now. So we're limping along. We're doing okay. But yeah, it's been a real challenge.
Yeah. Well, in our Samaritan in Washington County, where I have a little bit of information on it, the CNA issue is where the real employee problem is, and are you finding in your hospitals where you're having the same CNA shortfall and nurses having to expand their duties, which may even contribute even more to their burnout if they're having to do two separate types of jobs? So, I mean, in our Samaritan, we use some ARPA funding to increase the compensation for CNAs in order to get a little bit better staffing with that. Is that anything that the hospitals can do also to?
Yeah. Well, I don't know about the additional funding. I know that they've actually announced that they're going to be increasing the base rates for a lot of our employees here, and maybe part of that is they didn't really tie it to that increased reimbursement or funding from the state and the federal government. But that is something that's happening with CNAs. And, you know, the workload shift from CNAs to nurses isn't just from CNAs. We also have shortages in environmental services staff and others. And so, you know, nurses are having to do all kinds of jobs that they hadn't had to do in the past. And so it's just, it's been a real challenge for them. And, you know, I have to give them a lot of kudos.
CNAs has been a long-term shortage of CNAs. Even prior to this, they've been very difficult to find. It's a difficult job, and the pay, you know, has traditionally been less than you know, you can make at Amazon, and I think especially in the nursing homes, it's a very difficult area to fill, and so I think everyone is raising the pay of CNAs and pushing that up, but there's only a finite number of people who are trained and are willing to do that job. So it's a huge issue, I think, in all of healthcare.
Thank you.
Yeah, and I would add as well, you know, I think, you know, at least locally, we're certainly seeing a shortage of staff. As Nitish said, everybody from environmental services to food services, and now it's really impacting nursing and even physicians as well. I think everybody's just getting burned out. I think the people that were there that were putting in so many extra hours and overtime hours, I think people are just getting exhausted after 2 years of this. So it's difficult, you know, with that baseline shortage, to ask people to work additional because they're just exhausted.
Well,
It's no longer about the money, unfortunately. It's the shortages and extra shift pay and all those are, you know, it's really dramatic changes in the amount of money that a nurse can work or can make on an hourly basis, but they're just tired. They just can't take any more shifts, and so there's, no matter how much money gets thrown at them, you know, they just had enough.
Right. Well, let's hope that this Omicron variant burns out like it did in South Africa throughout the world, and the pandemic comes to an end, and we just learn to live with what we have. So, Okay.
I have a question.
Sure.
Can I ask? So after like this eases up a little bit, are they, and some of these nurses want to come back that aren't decided not to be vaccinated, are they going to still keep that mandate up? I mean, if there's such a shortage, would you not welcome them back or?
Well, I think that, there's mandates for vaccinations in many of the healthcare systems for regular flu and for, there's all sorts of mandates for vaccinations. So I don't know, it would kind of depend on whether, how much COVID is an issue and whether the vaccine is still appropriate. But I would think that that would that would be a while before they would make the decision that a mandate wasn't necessary.
Yeah, and I would agree that I don't think that's really been an issue here in Children's Wisconsin, because with the flu vaccine, MMR, hepatitis B, varicella, there are all these vaccines that people had to get anyway. So anybody who was, didn't want to get a vaccine, they probably would have left a long time ago with all those other mandates. And as far as the numbers here in my health system for those who refused to get the vaccine, it was way, way, way less than 1%. It was a very small number. In my department, we can count on one hand the number of people who left, and we have 140 people in my pharmacy department. We had 2 people who left for that reason. So I don't know how much of an issue that really is, just because of we're just used to it. We're used to getting poked all the time.
Yeah, and with this, if the variants continue on the course of Omicron, now Pfizer says the vaccine for the Omicron is due in March. Well, the wave should be over by then. And if this continues on this, every time, if we get another new variant, it's going to take time for them to come up with another vaccine, and it's likely to, the wave will have already passed. So I don't know. I'm not an epidemiologist. I'm not a virologist. I don't know how to deal with that in the future. So,
but after, as we get into the chronic phase of this, the vaccines they will do like they do with the flu. They predict what the next flu vaccine is going to look like, and then they produce a vaccine that they hope will be a match. The match this year doesn't seem particularly good, but for the regular flu. So they'll probably be doing that with the COVID-19 virus as well, trying to predict, what's the next year's strain going to look like, and then try to have a vaccine that is appropriate for it. So it'll probably be very much like we're doing for the flu right now.
right. Yeah.
Are you testing for the flu right now?
Yeah, they are testing. They're certainly. I'm not sure. I've not heard a lot about flu being an issue as of yet, but it certainly is a possibility.
Yeah, I can say just anecdotally, I don't know the numbers off the top of my head, but anecdotally, we have been seeing a decent amount of flu. This year, it seems to be influenza A so far that we're mainly seeing, but I don't have those numbers. But it's certainly a decent amount, considering last year we hardly saw any.
So the flu shot, that didn't cover the A, are you saying?
Unfortunately, no. The flu shot wasn't a good prediction this year.
Great.
So wouldn't we be like telling people, if you're sick, just stay home? I mean, wouldn't that be the thing to do? I mean, all this stuff, and it's just, I think it's just like common sense. If in the past, you stayed home if you were sick. And I think more people need to wash their hands and stay home and just follow, guidelines like that. But I don't know.
Yeah, for sure, people, if you're a really good employee and you really are really dedicated, please don't be a hero and come into work, because there'll be other people who pick up the pieces and you won't infect and get other people sick. If nothing from this pandemic is more important than if you're sick, just stay home until you feel better, please. So, okay, any more on COVID? Okay, we'll move on to the communicable disease update.
All right, we've kind of already touched on the communicable disease update. There isn't anything earth-shatteringly different this time than there was in November at our last meeting. Numbers across all the diseases are pretty much, for the most part, back up to pre-COVID numbers. There were a few outbreaks in 2018 before the pandemic that were a little bit higher, but generally speaking, we're seeing similar trends to pre-pandemic. Latent TB is increasing, as we've stated before. That's due to differences in the way that it's reported now. It's just more widely reported, more widely tested. Same as Lyme disease. They're doing better testing and better reporting on that as well. Outbreaks that are non-COVID specific are slightly down due to people staying home and wearing masks, generally speaking, using the COVID precautions. I believe that that is helping us keep some of the other things, such as influenza, down. STIs still also high, as they typically have been in the past year or so. Our Sexual Wellness Coalition is working on figuring out some ideas that we can do to help decrease those numbers, but that, of course, has been kind of on the back burner to some degree due to COVID in the past couple of years. So we're working on trying to amp that back up to deal with the STI numbers. But I don't really have anything else on this report to point out unless any of you have any questions.
Any questions from the panel? Okay, hearing none. Thanks, Kim. We'll move on to the WIC program update.
All right, WIC, similar to the communicable disease update, has no huge updates on it. Our waiver to allow WIC participants to continue visiting us virtually has still been extended to at least April. I would anticipate that it gets pushed back even further, probably into the summer, but we are going to wait and see how that goes. Meanwhile, our WIC staff has been fantastic. They've completely shifted the way that they are operating in order to handle those virtual appointments, and we've actually seen really high numbers of participants and people that are coming back for their second visits, because it's easier for them in many cases to visit us virtually than it is to put gas in their car, take their kids with them, everybody, family trip to the health department. So this is actually one bit of a silver lining in the mess that has been COVID with our WIC program. Any questions about WIC?
Any questions from panelists? Hearing none. We'll go on 2022 meeting dates you have in your packet today, March 11th, May 13th, July 8th, September 9th, and November 11th. Their next meeting date, I'm assuming, is March 11th, unless there's something that happens that we meet earlier, but that's the regular schedule. Are we going to be doing in person anytime soon, do you think, Kim? Or you think we're just going to maintain this for ongoing?
I know at one point our goal was January, and we clearly missed that. I guess that's up to the group to decide.
I think we can kind of.
We can wait and see how this wave goes and reassess in March.
Yeah. I think that's a good idea. We'll just see where we're ending up, and hopefully this becomes in a rearview mirror. But we'll see how it goes. So.
How is can I ask Kim a question? How are we doing with the mental health services in the counties? Are we being overwhelmed with issues, or how is that working?
Well, we have Julie Driscoll on board. Do you want to speak to that, Julie?
Hi, how's everyone doing?
Good.
So I would say we have seen an increase in the number of people that we've had to send out to Winnebago Mental Health, and so for crisis intervention. And we've been working on right now we're working on a marketing campaign with Epic Creative on helping people to understand where they can access services when they need that. I feel like the schools are doing a pretty good job of trying to support the mental health of folks, but as you may have seen, there has been across the state and actually across the country an increase in opioid overdoses during the pandemic, as we had started to see that decline somewhat, but that has increased, specifically related to fentanyl. And so, we've been doing a lot of different strategies within Washington County specifically to combat the opioid crisis, but we've been trying to adjust to, what's been going on with folks because of, the social isolation and the lack of access to services. I mean, we've seen that rebound a little bit in being able to access that, but it's still something that's a struggle within the county, where our numbers are, I don't know about Ozaukee County, but our numbers have been up in 2021. So it is still, an issue that's at the forefront of what we're doing. And I know Kim could probably speak to this a little bit as well. They just, started doing the work for the CHIP and trying to refocus and reinvigorate our coalitions to bring our community partners together to try to figure out the next strategies for addressing the ongoing, mental health and substance abuse needs for both communities. I don't know, Kim, if you want to talk about that a little bit.
Yeah, I was actually just going to add that part about the CHIP. Our strategy team has been working very hard over the past couple of months to identify the top priorities in both of our counties. And mental health is definitely one of them across the board. So the next step in that process is to identify specific goals that our department will be working on. And we're doing that over the next few weeks, along with our community partners, human services, and the hospital systems. And so we're hoping to have an update for all of you in March on what that's going to look like.
Are you looking at virtual services at all through this?
Potentially, yeah.
Chris, you had
So-
something?
Yeah, just for the benefit of our audience or anyone who might be watching, Julie is the director of our Human Services Department in Washington County. So,
Oh,
and
thank
she's
you
very
for-
good at it.
I forgot to say that, didn't I? Sorry, Julie.
That's okay. That's why I'm
So,
here to back you up, Don.
Thanks.
I had a question about the Narcan nasal. So I know that both of our locations are handing that out. I just wanted to know what the uptake is on that. How successful has that program been, and what are we doing for reaching out to schools or businesses or any place else for that Narcan nasal?
Sure. We haven't really been able to kick it fully off the ground yet. We've been working on getting all of our staff trained. So as of right now, we have staff trained in both offices that are prepared to give it out if someone were to come in. And the next steps in that are to help spread the word that we have this program available. So that hopefully will be reaching out to the general public in the near future more widely, but we haven't gotten quite to that point yet.
Okay.
Yeah.
Yeah. And I was at I did attend the last meeting, but I think I was a little bit late because I saw in the minutes that, that we're offering that. And I have to tell all of you that we unfortunately did have to use Narcan nasal in our own household. So when I saw that in the minutes, I immediately went to the website and sent that to my wife, who said, we got to get that now, because we were looking at different options for getting a replacement of that Narcan nasal, and now we know that it's there. So thank you to whoever helped to get that going, and we'll certainly try to get a dose. And I'd like to see us, kind of widely promote that a little bit more. I'm involved in scouting, and we've done a little bit with that, with getting the scouting leaders to know about Narcan nasal. And we had a talk by one of the groups down in Milwaukee who came up and handed out a bunch of the Narcan nasal. That's the reason we had it. Thank goodness we didn't anticipate needing it, but we had a need for it, and it was there when we needed it.
Okay, great. Okay, anything else from anybody? Okay, hearing no further, thanks everybody for attending. It was a great discussion today. And we are hereby adjourned. everybody have a great week and great weekend. Hopefully,
I have one question. Are we still looking for a health director? Or is Kim, are you it?
I am it for now. I don't really have an update for you, sorry.
ongoing process.
Ongoing? Okay.
Yeah, ongoing process. So,
All right.
okay. All right, everybody have a great one. Take care.
Thank you.
Thanks, Kim.